While the death rate from COVID-19 in Mississippi continues to rise, the case rate is actually showing a decline. The 16 WAPT's Michaela Franklin spoke to a local health official who says Mississippi still has a way to go in the pandemic.
COVID-19 cases in Mississippi seem to be declining, but doctors here at Baptist say we're not out of the woods just yet. And if it's anything we've been cured on throughout this pandemic, it's the overconfidence in a downturn of cases.
What I tell them is that we have a long way to go before we get well enough not to have bad things happen.
People tend to become complacent as cases decline. And in terms of the vaccine, one of the many things we hear when people contract COVID-19 is,
I've had it. I've got great immunity. I don't need it. It's not good enough. It just isn't.
Dr. Threlkeld with Baptist Hospital says your natural immunity works, but your natural immunity along with the vaccine is even better.
No matter where you stand right now, your safer situation is to get the vaccine because you will get a substantial improvement in your protection, whether you have had the disease in the past or not.
Right now, 1 in 500 people in the United States has now died of COVID-19. To put things into perspective, a football stadium has seats for at least 60,000 spectators.
And say, okay, 1 in 500 of you 50,000 people, 100 of you are not going to make it home. Nobody would go to that game, but we're buying tickets to that game every day we don't get vaccinated.
Over 40% of Mississippi's population is vaccinated. Doctors say more is needed.
Not nearly enough. I mean, there are still cases. I mean, that means, that 60% aren't. And so 60% of the many deaths we have seen that still can happen, that's an entirely unacceptable number.
Doctors say there's not a new variant that we know about waiting in the winds, but we remain at risk as long as the COVID-19 fire continues to spread around the world and generate some new variants. In Jackson, Michaela Franklin, 16 WAPT News.